Hello, and welcome to this brief introduction to animal-assisted interventions. The main purpose of this video is to clarify the distinction between animal-assisted therapy and animal-assisted interventions. While animal-assisted therapy has been used for centuries, it has only recently gained acceptance as a viable adjunct to therapy. If we want our animal-assisted therapy practices to be successful, we need to have intentionality in our practice. Understanding the difference, determining your intent, and developing a program accordingly is important. Throughout this presentation, I do focus on dogs, as I utilize dogs in my own practice, but you could easily substitute any other animal that you would like. First, take a look at this photo. How do you feel? What does it make you do? Most people respond with smile. This dog is smiling, we smile in return. It's this connection with life, our innate desire to seek positive experiences from other living beings, that makes the human-animal bond possible. The human-animal bond is what makes animal-assisted therapy possible. Many people think of animal-assisted therapy as this. My therapy is quite simple. I wag my tail and lick your face until you feel good about yourself again. Which is funny, but on some level true. Having this positive interaction with a living being who doesn't have to love us, but chooses to, who unconditionally accepts us, flaws and all, is very therapeutic. The most accepted definition in the literature of animal-assisted therapy was developed by Pet Partners, and it's this, in the simplest of terms. Animal-assisted therapy utilizes an animal as a main part of treatment. It's not merely a dog in a room. The dog has a specific purpose in the treatment plan. The person using animal-assisted therapy is a professional in a service area and understands the population. Sometimes the professional practices animal-assisted therapy herself, or it is done in partnership with someone who has a certified therapy animal. The clients or patients are seen on a regular schedule. There are goals determined for the client or patient. Lessons or therapy is designed to achieve those goals. A form of measurement and evaluation is created to determine if it's working, and modifying the treatment if it is not working. Animal-assisted activities, however, are visitation programs mainly. There is no consistency necessarily, nor are there goals or evaluations needed. There is still value in animal-assisted activities, as any time someone who is hospitalized or in a nursing home can be encouraged to participate in a social setting, experience normalcy of life, even briefly, laugh, remember pets of their past, or just forget about being sick for a while is good. Animal-assisted therapy can be practiced by any professional. Counselors, teachers, social workers, physical therapists, occupational therapists, nurses, nursing home staff, and more. And a variety of animals can be utilized as well. Hermit crabs, dogs, horses, rabbits, llamas, cats. Dogs and horses tend to be the most used in animal-assisted therapy because of their social desirability and their predictability, but any animal can be used and certified as a therapy animal. When practicing animal-assisted therapy, we determined that we need to establish goals. What types of goals can we set for our clients? We can set physical changes as our goals, improving motor skills, strengthening muscles, making participation in the rehabilitation process more desirable, or modify our body language, and there's so much more. There are cognitive changes that we can use as our goals. Whether the client has an animal phobia that they want to resolve or lack of confidence in their abilities, animals can be incorporated to help alter their beliefs about themselves. For example, in the READ programs, kids who struggle with reading will often not read aloud for fear of ridicule, or they'll avoid reading altogether. But in order to become a better reader, they have to practice. Being able to practice in a safe environment with someone who doesn't care if they stumble over their words and does not stop to correct them, they are able to improve their reading scores. Physiological changes, just the act of stroking a dog, research shows, provided there are no fears or negative experiences, has been shown to increase the love and attachment hormone oxytocin and reduce levels of cortisol, the stress hormone in the brain. It reduces our blood pressure and heart rate. If a client is in therapy and is feeling anxious or judged, he's not going to be able to engage in logical functioning. More likely, he will react to his feelings, making it difficult to take in new information or be open to the therapeutic process. By removing the attention from him and by allowing him to calm down, therapy can begin. Behavioral changes. Oftentimes, our clients don't realize how they present themselves to the world or how they are perceived. In our program, where at-risk youth are training dogs, they can bond with dogs who have similar traits. For example, both are hyperactive, both are very timid. They are able to see their own behaviors more concretely. With behavior modification of dog training, they are also able to see that it works and will be more receptive oftentimes to their own behavior modification. And finally, caring about and caring for animals brings out the best in us. In this example, Robert Stroud was incarcerated at Alcatraz for murder. There was a movie about him called Birdman from Alcatraz. His story is this: he found an injured bird in the yard and began, with the help of his fellow inmates, caring for the bird. The penitentiary saw immediate changes in the inmates and conducted a year-long study where they compared differences in inmates from this unit to another where they were not caring for small animals. They found during this time there was less of a need for medications, fewer needs for restraints, less violence, and fewer suicide attempts in the unit where they were working together to care for the birds. If you're interested in learning more about animal-assisted therapy or becoming a practitioner, Oakland University in Rochester, Michigan offers an online animal-assisted therapy certificate program. For more information, please visit oakland.edu/animal-assisted therapy. Thank you for watching.